You'll see in front of you our 4 presenters for this evening. I'm going to call on them in turn, and we'll give the floor in the first instance to Ailish Moriarty. Ailish works as a milk quality manager for Kerry Agribusiness. She's qualified a BSc Food Technology from UCC and later went on to complete a Master's and MBA. She comes from a farming background, works on the family farm, and is extremely passionate about animal health. Through her interaction with farmers over the last few years, she identified that a need existed to further look at the whole area of animal health and milk screening for disease. So she embarked then on a Nuffield Scholarship in 2019 with a particular focus on this topic. The rationale behind the topic, assessing the role of milk screening for disease within the development of an effective herd health system, was to provide insight and information on disease prevention and determine how to be proactive rather than reactive to animal health. Ailish presented the findings of her Nuffield Scholarship to the industry last year, and we felt her findings complemented what we're trying to achieve for Animal Health Awareness Week. Therefore, we're delighted that Ailish has made herself available to speak at this year's webinar. I would like also to say that we're delighted this subject was the topic of a Nuffield Scholarship, and that we were very much delighted to see other animal health topics be studied within the auspices of the Nuffield Scholarship. We as a department will be happy to provide any support we can. So Ailish, I'll hand the floor over to you and perhaps ask our other colleagues to maybe turn off their cameras while give you centre stage. Thanks very much. Over to you, Ailish.
That's great, Martin, and thank you for that great introduction this evening. And I'm delighted to be able to participate this evening, giving you an overview of my Nuffield Scholarship report. Now, can everyone see my screen there?
Yes.
Great. So my Nuffield Scholarship report focused on assessed the role of milk screening for disease within the development of an effective herd health system. I completed my Nuffield Scholarship in 2019, and I was probably one of the last scholars fortunately being able to travel the globe to, I suppose, to look at case studies that would help me formulate my final Nuffield study report. I'm just trying to move on there now, Joe.
Try the left, right arrows working, or it should be. Try double tap them, or hang on a second. I'll take the presenter off you for a second and give it back.
Okay.
Is it going on there for you? Okay. Before I give it back.
No, I'll have to get there now.
Okay. Okay, just try go on and slide there now. Just to see.
No, it's forwards as well.
Just hit escape for a second, or press escape. Can you hit the keyboard? Or...
Now we have. Okay, great. Now, as Minister Hayden described this evening, antimicrobial resistance is a major global public health risk. AMR is estimated to be responsible for 33,000 deaths per year in the EU alone and 700,000 deaths globally. Ireland has adopted the World Health Organization One Health approach, which recognises that human, animal and environmental health are all interconnected. Ireland has just launched the One Health National Action Plan on Antimicrobial Resistance 2021 to 2025, INAB2, which provides the strategic roadmap for continued action to address this AMR challenge. New EU regulation comes into force in January 2022, and this will put much more emphasis on the prudent use of antibiotics and a greater reliance on prevention. My study built on this solid regulatory foundation, and 4 principles of proactive herd health management apply. Prevention is better than cure, combat disease and AMR, continually assess risk, and ultimately preserve the integrity of our food products. One process to determine herd health is milk screening for disease. This can support evidence-based decision making. And at the heart of this is good data, whereby the committed farmer and the capable vet can share, interpret, decide and adopt health recommendations based on the milk screening results. At its simplest, milk samples are taken 4 times a year and analysed through an ELISA or PCR machine for detection of host antibodies. Various endemic diseases like BVD or Salmonella can be tested. Milk screening can be conducted on bulk or individual milk samples, as in the case of Johne's disease, but it is important to consider test characteristics and limitations. Milk screening can have many overarching benefits. It can benchmark and provide an initial impression of the herd. It can identify trends and triggers. There is value in continuing to protect the negative and naive herds, but most importantly, it can alert the farmer and the vet to any potential herd health issues which are occurring on farm. One of my first case studies was to examine what technical supports are available to assist farmers. One cloud-based solution is myhealthyherd.com, designed by Pete Orphan and Dick Shipley. This system measures and analyses disease-specific risk using algorithms to create a traffic light system of characterization. It ranks individual risk to enable prioritization of control. Biosecurity, biocontainment and resilience should be factored in when analysing these results. And clinical assessment of the results is completed by the vet with 3 to 4 key action points communicated and then agreed with the farmer. All stakeholders within the dairy supply chain need to work in partnership to adopt roles and responsibilities to collaborate, lead, drive and empower to deliver outcomes which best serve the industry and the consumer. Throughout my travels, I witnessed various approaches on how best to achieve this. In the Netherlands, I was able to see firsthand Pharmavet Collaboration. Traditionally, the relationship that existed was one of reactive veterinary care, with the vet's income predominantly coming from the treatment of sick animals. Utrecht University, in collaboration with Courage, set out to change this, and the innovative project Healthy Partners was developed. The vet now had a vested interest, as the vet's income depended on the farm achieving outlined health targets. Feedback from Martin Noel, a farmer who was a serious advocate for the initiative, was that the vet was now a key partner in decision making. There was shared responsibility, and the vet was a valued member of the team. Red Tractor have adopted a lead approach. Red Tractor is one of the UK's largest food standard agencies, which covers animal welfare, food safety, traceability and environmental protection. In October 2019, the Red Tractor revised its standards, where it is now mandatory that a livestock health plan is written in conjunction with the farmer and the vet to actively demonstrate health and welfare on farm. An accredited British Cattle Veterinary Association vet declaration is required, and the farmer must participate in schemes such as BVD Free England. Revision to this standard has a massive impact in participation levels in the UK's National Johne's Management Plan, and by the end of 2020, it was estimated that 95% of farmers were on board. Friesland Campino have adopted a drive approach. Friesland Campino is a farmer-owned cooperative based in the Netherlands, Germany and Belgium. One of Friesland Campino's unique selling points is it is always focused on and prioritised animal health and welfare. This strategy has added value to the brand, particularly in relation to its export market. It is driven forward with zero tolerance. If animal health checks, which are compulsory, do not meet the required standard, the milk will not be collected from the farm. Farmers must step up and demonstrate disease-free status in their herds. Data is currently stored in silos, and the development of a central data point is necessary to oversee the various animal health checks and indicate breaches of standards. And this development of this database is a key priority for Friesland Campino. TISA, a Danish organic cooperative, through working in collaboration with their farmers, has successfully eradicated Johne's disease. A farm-specific control programme was designed with a TISA representative and with TISA paying for the cost of the individual miscreening. Farmers met regularly in groups to troubleshoot and discuss disease progress. Once Leones was eradicated, the farmer was incentivised and paid a bonus for their milk. Farmer empowerment has enabled farmers to make significant progress on the eradication of Salmonella Dublin. Erling Bond, a Danish farmer, emphasised that the key factor which aided disease control was availability and access to a central cattle database. The Danish cattle database was very impressive, with Erling even able to request extra milk screening tests himself if required. The collaborate, lead, drive and empower approach has helped me formulate my key recommendations. All stakeholders, the committed farmer, the dairy industry and the veterinary community need to be at the table to co-design proactive herd health management programmes. While the early adopters in the veterinary community have led the way in terms of a collaborative knowledge share approach, the wider community of vets must come on board. The strength and importance of the farmer-vet relationship just cannot be underestimated, and the vet can become a key influencer of scheme awareness and uptake. A clear financial business model must be decided, and where co-funding support could be provided by the targeted advisory service on animal health. But it is important that all partners and stakeholders are vested, and co-funding support should be provided by the farmers themselves. Animal Health Ireland's Veterinary Risk Assessment and Management Plan, VRAM, should be launched and become mandatory for all farms. This template has been successfully used for Ireland's BVD and Leones control programmes. A herd-specific action plan should be formulated, and this would decide what young stock or milk screen tests are required. All stakeholders within the dairy industry should lead and empower farmers and vets to achieve better herd health outcomes. We need better decision support. Development of simple, user-friendly formats can guarantee follow-through. We must fully utilise ICBF, the only farmer-owned national herd database in the world. All service providers within the industry should consistently promote this service and encourage more farmers to access the on-farm support tools which are available. The Irish dairy industry should take the lead, embracing new technologies like milk-infrared spectrometry and precision technology with confidence. To conclude, at the beginning of my scholarship, my emphasis was just on milk screening for disease, but my realisation now is this is only one aspect of effective herd health management. Through proactive herd health management and the effective use of data, the committed farmer and the engaged vet and the collaborative dairy industry can lead, drive and empower to protect herd health and the sustainability and profitability of Irish dairy farms and industry. But at all times, we must honour our commitment to deliver safe, wholesome food to the consumer. I would like to thank you all for giving me this opportunity to present to you this evening, and I'd hope you would agree that my study topic is very much aligned with the Department of Food and Marine's Theme of the Week, and that through development of an effective herd health system can indeed contribute to sustainability for the future. Thank you.
Thank you very much indeed, Ailish. Really top-class presentation. I think you've focused on the likes of power of data, the actual output from teams. Collaboration has been a critical issue in driving matters forward. Also focusing on animal health has been a profit center in the context of farming, as distinct from just a cost of complying. I think the outcomes and the recommendations you're making really do feed into the future of animal health as a core element of sustainable livestock production.